Dual antiplatelet therapy is often a concern in those with high bleeding risk, but the risk of stent thrombosis is a nightmare for the interventional cardiologist after a percutaneous coronary intervention, especially after complex PCI. So, what is the way out? Master DAPT trial sub-analysis gives us some relief. The analysis showed that high bleeding risk patients free from recurrent ischemic events at 1 month can consider discontinuation of DAPT. In high bleeding risk patients, DAPT discontinuation in those free of recurrent ischemic events at 1 month was associated with similar NACE and MACE and lower bleeding rates compared with standard DAPT, regardless of PCI or patient complexity. MACE stands for Major Adverse Cardiac or Cerebral Events and NACE for Net Adverse Clinical Events. NACE is a composite of all-cause death, myocardial infarction, stroke and bleeding events. 1,196 patients in the master DAPT trial had undergone complex PCI, while 3,383 had undergone non-complex PCI. The study had compared 1 month DAPT versus standard DAPT of 3 months or more in those with high bleeding risk. Patients received a biodegradable polymer sirolimus eluting stents. This was an investigator-initiated, randomized, open-label, non-inferiority trial with sequential superiority testing. Patients were randomized 30 to 44 days after the index procedure if they remained uneventful till then. Those randomly allocated to the shorter duration of DAPT immediately discontinued DAPT and continued single antiplatelet therapy until study completion. Those who were receiving oral anticoagulants continued single antiplatelet agents up to 6 months after the index procedure. Patients allocated to the standard treatment continued DAPT for at least 5 months, which would mean 6 months after the index procedure. Those receiving oral anticoagulants would receive DAPT for at least 2 additional months, which would make it 3 months after the index procedure. Thereafter, they were on single antiplatelet therapy. The results of the master DAPT trial sub-analysis is promising for those at high bleeding risk undergoing complex PCI. Let us hope that similar results will be documented by blinded trials as well soon.